Have you ever noticed that your skin seems to flare at the worst possible times? Right before a big presentation, during the holidays, stressful season at work, or even worse, before your wedding? During a loss. Patients tell me all the time, it was under good control until my life got so stressful. It is not a coincidence. Your skin is often one of the first places stresses show up. Today, I want to talk about why skin conditions flare when life gets hard and what you can actually do about it. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life. Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here, because healthy, beautiful skin isn't about perfection, it's about feeling confident and healthy. Let's get started. So today we're talking about stress and the skin, and we often feel like in the dermatology clinic we turn into psychologists a lot, and patients get some lectures about managing their stress. But why do skin conditions flare during times of stress, whether you recognize the stress and anxiety or not? One of the reasons is increase in cortisol. And that cortisol revs up your immune system and has effects on your body, things you don't see. Gastric reflux, gastritis, painful stomach, irritable bowel, effects on your heart, effects on your blood pressure. We don't see these, but what we do see is your skin. And that revved up inflammation and cortisol can cause a lot of skin conditions to flare. Stress also causes some immune system shifts that lead to more inflammatory skin disease. And in a lot of skin disease that we treat is inflammatory. I know many of our patients feel like we throw that word around. Oh, your skin's inflamed, you're having inflammation. If we treat the inflammation, all these things, what does that really mean? It's a complex system, your immune system, but there's kind of uppers and downers on an immune system. But when you rev up the pro-inflammation, the pro-redness, the itch mechanisms, the ball gets rolling on the skin disease front. The other thing that often happens during stressful times is sleep disruption. This also happens in menopause, which we'll talk about in a kind of perimenopausal, menopausal talk. Our two PAs, Ellie and Alexis, just had babies, so I'm quite certain they are experiencing some sleep disruption, as is one of our new RNs, Sarah. So they may have some increased inflammation. But the other thing that happens when you don't get a good night's sleep is impaired barrier function of the skin. Another buzzword that's thrown around in clinic, your skin barrier is dysfunctional. We need to help your skin barrier. Use this moisturizer to help your barrier. We try to break it down and make it make sense. But when we talk about sleep and your barrier, believe it or not, so many cells are renewed in your body with a good night's sleep. Memories are formed, immune system is formed, the protective immune system, but your skin barrier repairs itself. And your barrier is your barrier to the world. It protects you from infection, from getting dry. It keeps everything hydrated. It will initiate immune response at a threat. Your barrier function is critical to your skin well-being. And sleep actually is critical to repairing that barrier. And a lot of the skin diseases that flare from stress, they are barrier function disorder diseases. Some of the critical immune functions, the downplaying of irrational inflammation, also repairs itself overnight. The good immune, the one that makes antibodies to infections and keeps you healthy, repairs itself overnight. But also the immune system that says, hey, there's too much inflammation in the skin. You guys need to calm down and quit making this person itch and rash. All of that takes place at sleep. So the sleep disruption, from whatever reason, can be a big player in your skin health and upregulation of inflammation. Why does stress show on the skin? Why does Dr. Rostan say to you, is this a stressful time? Are you feeling stress? And the reason I do is because we can see the skin. I can see upregulation of inflammation, increased cortisol effects in the skin. And I mention it because it may have an impact on the rest of your life. Your blood pressure, your heart health, your gut health, things that you may not see. We have this opportunity to intervene towards a healthier lifestyle if we see your skin condition flare during times of stress. What do we see, or what conditions typically flare with stress? Well, there's acne. We see increased breakouts, increased cystic breakouts, particularly with cortisol. There's a condition called seborrheic dermatitis, extremely common. Red, flaky skin, commonly around the nose, eyebrows, scalp, and this can really flare during stress. One of the physicians I worked for years ago, you could just see him coming down the hall and you knew, whew, it's going to be a stressful day, because he had that increased redness around his nose and medial cheeks and in the eyebrow, just a telltale sign. Definitely eczema. Eczema is a barrier dysfunction disease. So if you have eczema, we've talked to you about repairing your barrier and healing the skin, but the stress via increased cortisol, dysfunction of immune system, lack of sleep breaks down that skin barrier, and all of a sudden your skin is red, itchy. Classic places are around the elbows, knees, but also other areas, legs and arms, itchy red skin. If you've never had eczema and your skin starts to get itchy and red during a time of stress, that might mean we've kind of opened up the door to eczema. Very treatable, but maybe that door has been open. Psoriasis is another one where someone can be in really good control of their psoriasis. Psoriasis is a condition where it's very apparent on the skin, big, thick plaques, knees, elbows, but can happen all over the body, and that can flare with stress as well, even when it's under good control. So those are the things that we typically see. I think the most common is acne, and adult acne, where patients themselves say, "Oh, I've been so stressed out, but my face." Then we try to intervene both with the acne, but maybe about, well, what are we going to do about the stress? And sometimes there's just things you can't do, but I always encourage my patients to look for solutions, because now we have this clue that you're having an effect. The other thing we talk about with stress is it can make the next flare more readily happen, more easily happen. So you've got control, like good control, and good control is key to disease control. But then you have stress and a flare. Well, that skin is compromised from the increased inflammation and the decreased barrier, and then we prescribe something that gets a little bit under control, but it's not quite there, so it's more likely to flare. It's just like hot water near boiling, and you want to bring it back to boiling. You can do it much more quickly than a fresh pot of water. You're almost there. You're almost at the tipping point. So when you're flared, it's easy to go over into that tipping point again. And I think that's why here in the clinic, we talk about maintenance, maintaining your medications, good night's sleep, reduce your stress, healthy lifestyle, but also maintain the barrier. Same thing with emotional stress. I think, if we talk about stress, you think about job, kids, school pressures, homework assignments. We treat a lot of high schoolers, and they're under a lot of pressure, but it also can be emotional stress, worrying about something, these stressful events. In emotional stress of losing someone you love, this too puts a strain on the cortisol axis and inflammation, and can cause skin disease to flare. We've talked about stress in the skin, and maybe you're saying, you know what, that's funny. When I'm stressed out, I get red patches, or I feel more itchy, or this flares, or I get hives. Should I come in and have that treated, or should I just let it go away and wait till the next stressful episode. I think medical management of the condition can really help manage these flares during stress. Getting their acne under as good a control as you can, managing the eczema, maintaining the skin barrier. We can help you with that. And on that one, we almost always use completely over-the-counter medications, but we can guide you in that treatment and help you through that process. So I think the balance of medical management as well as home management can be very helpful. We encourage our patients to, hey, call us early. If you're flaring, let us nip it in the bud with something. Maybe we can call something in. Maybe we need to see you. Maybe things can be done in the office. So we are here to help all our patients get through these flares. Again, the reason being is the quicker we get through a flare, get that temperature of the water down, the less likely that water is to reach boiling again, and it's the boiling water we wish to avoid. So I would encourage anyone who's suffering from a skin condition that you think keeps flaring from stress, even if we don't even talk about your stress, you feel like your stress is personal, you don't want to talk about it, we will deal with your skin and give you the tools. I think this week I said to patients several times, they weren't quite where they wanted to be, not quite near goal. So we talked about a lot of different treatments. And I said, I just want the tools in your hands for you to succeed. If this happens, you do this, and you have this tool. And if you don't have this tool, please communicate with us and let us help you, whether it's see you in person or call in a necessary tool or tell you what to buy at the drugstore. It's totally treatable. I think working together as a team, your medical team, and you can get really good success with your skin, even during stressful times. And then, honestly, during stressful times, I think this is what separates Charlotte Skin and Laser from some other practices. Our niche that we like to fill is big office expertise. We like to offer you the best in medical and cosmetic care with a small office feel. Many of you know we've been growing. Many of you might be dismayed to see us growing and think, there goes that hometown feel. There goes the little office. We talk about this in staff meetings, and I talk about the touch points with patients and meeting them where they are and helping them when they need help. So big office expertise with small office feel. If the stress is personal to you, you can hold it to yourself, and we'll still keep trying to help you with your skin disease. And that's where I think the two can come together. You don't have to hide out at home because you're afraid you're going to get a lecture from Dr. Rostan about your stress. You might, but I'll blow it over, and we'll give you help in the medical department as well. So, again, even if you're holding your stress to yourself, I would encourage you to deal with it because it's possible that your skin condition is making your stress worse, right? So you've got stress, the skin condition flares, you're stressed about the skin condition. We see that all the time, particularly if it's on your face or you're itchy or it's keeping you up at night. So to break that cycle, I would encourage you to get medical help. Let us give you the tools, again, to put that fire out so you're not stressing about your skin disease. The stress causes the vicious circle, the vicious cycle. Also, however, if you come in, you think you're holding your stress to yourself, but maybe we recognize it. And I ask you, are you under a lot of stress? Is this causing some stress in your life? Maybe you want to open up. We have a lot of resources to guide you to for counseling, and maybe it's school organization, maybe it's dropping something, empowering you to drop the thing that's just too much on your plate and you just need a little encouragement. But we do have some resources to guide you in that department. None of us here are psychologists, therapists, or organizers of your life or tell you how to do that. But we recognize that these are a problem in many people's lives and that does affect their skin. So we try to have those resources present and available for you. So just wrapping things up about stress in the skin, what can you do? What will help you get control during times of stress. One thing is don't slack off on the maintenance of your skin condition. Keep your acne treatments going, even when you think you're clear. Keep those eczema treatments going, which mainly involves the good skincare with moisturization, gentle cleansers to maintain the skin barrier. Double up on your skincare if you know you're going into a stressful time, right? I'm about ready to travel, or I'm going snow skiing, it's going to be dry, and I'm going to flare, and that's stressing you out. Just really double up on the moisturization. Give your skin the tools to keep itself healthy, and that barrier will do a lot for you. Focus on getting a good night's sleep. Focus on some stress management and managing your schedule, planning ahead for travel, having things organized so you're not stressed out. I know, easier said than done. I feel the same way sometimes. I got a lot on my plate. But I think just being proactive with your medications as well as how you approach stress. What advice would I give you if you come in? Well, a lot of times I very gently tell patients, I think you should get some help with your stress, your mood disorder, your depression. We're looking at the skin. I'm helping you with your skin. You and I don't know what's going on internally with blood pressure, heart, reflux disease, things that the poor sleep can affect in your health. So really, it's not just your skin, it's your whole body health. And that we see that a lot and try to help you and guide you in that direction. So if this has touched a nerve with you, we would be happy to see you in the clinic and give you the tools to manage your next flare. But maybe it'll just empower and motivate you to say, you know what, I really need to get something off my plate. That one committee I signed up for, that was one committee too many, and it's okay. We're all adults. People understand when you have to drop things or drop the ball. And I appreciate you tuning in and listening today. We are here to help you, and I hope that we can do it with big office expertise, with small office feel for these delicate situations. Thanks for listening to Queen City Skin. We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too. If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom. And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser. Here's to healthy skin and feeling your best. We'll see you next time.